So hi, I'm Sarah McKelvey. I'm a clinical lecturer in primary care at the University of Southampton, and the conference has been fantastic. It's really lovely just to see such an enthusiastic group of people interested in hospital at home and virtual ward research. And it's really nice that we've been able to facilitate a community, because this is what we're needing for the next steps in research in this area.
So hi, my name's Jennifer Robinson. I'm from the Oxford University Hospital's NHS Trust, and for me, attending the conference was to gain better insight to other virtual wards and hospital at home services throughout the country.
Graham Sutton, I'm one of the elderly medicine consultants here at Leeds, and I'm the sort of co-lead for our hospital home frailty service. We took our first patient right at the end of 2019, and then over until October 2020 we then went citywide. So I think for some reason, I don't know why, NHS England quite liked our service, so I've spoken to quite a lot of different trusts around the country, as well as a few in other countries. But I think the biggest thing that I've noticed is the difference in staffing levels, and therefore, or the staffing makeup, and also that some take more from step up, some more from step down. So it's that how you try and compare apples with pears or apples with oranges, because I think one of the challenges that we've had is sometimes when our managers have looked at data and questioned and looked at other local services, it's then having to go and talk to them, but then realising that they're very different to us. So if there was a research into how you can compare services far more easily and in a very timely manner, that would be great.
So I think this is a really exciting space to be working in, because actually the numbers of researchers who are now working integrated in trusts and also with bigger organisations such as NIHR, we can now form some really collaborative approaches to be able to look at what's happening here at scale, which I think will be absolutely fantastic. What I'm really excited to hear about is more involvement of patients and carers involved in the further development and co-creation and collaboration, and how we can bring that back into our integrated neighbourhood.
My name is Naveen Nagana. I'm the virtual lead for the program hospital. So, the conference is so good to meet up the like-minded personalities, and it's been well organized, and there have been a lot of discussion around the pathways, different ways of doing similar kind of work, and I've been much more interested in how each team is doing different things in their own way, and that is quite enthusiastic crowd about to change the system. I think we need this kind of enthusiasm to change the NHS in the long run.
Hi, my name is Shifa, and I am the pharmacist for Hospital at Home across Northwest London. What I was hoping to gain from today was to meet other people working in the same space as me, to share what I've been doing. So as a pharmacist, some of the work that we've been doing locally in Northwest London, to learn from others and to build up my network as well.
I'm Natasha King. I'm the matron for Patch, which is our hospital at home service in Northwest London. Over the next few years, I see hospital at home continuing to evolve. It's still a relatively new service in most areas of the country, but we've made amazing strides so far. We have lots and lots of pathways for stepping up and stepping down from hospital, but I want to see those pathways expanding. So I want to see lots more primary care referrals. I want to see pathways from the ambulance services and from 111, and I want to see expansion of nursing and AHP roles into the service, into advanced practice, and taking on more scope in their roles.